My name is Andrea. I'm 35. I am currently a mother of two. I have my 15-year-old Jalen. We have Jordan, who is no longer with us, but he's still my baby. So I already knew that he was going to have some issues. He had a hole in his heart, which he was going to eventually have to have open heart surgery. Jordan got here July 13th because I delivered 6 weeks early. Jordan was born on a Monday, and I didn't get to see my baby for the first time until Wednesday. They airlifted him to Raleigh Hospital. We went through multiple surgeries. We found out that Jordan had DiGeorge syndrome, which is a deletion of a chromosome, which causes his heart defect, causes his breathing defect that he had. As time went on at Raleigh Hospital, we had doctor meetings where they kept me updated on the different things that were happening to him and the possibilities of him not making it. Christmas morning, I called, like I always do, to check on Jordan, and she advised me to immediately get here. And when I came in, doctors wanted to talk to me, and that's when they let me know that medically there was nothing else that could be done for Jordan. So I just spent the night with Jordan, and I just prayed, and I prayed, and I can just remember saying, it's time. And I can just remember holding him in my arms, the nurse telling me, he's gone.
I wouldn't wish that on anyone. Being there as a support to my daughter, watching my daughter go through the agony was traumatic. And any mother knows to watch their child hurt and can do little about it is overwhelming in itself. But as you can tell, we've got a good support system together. I think it brought us closer together. It definitely helped us understand more of the issues that we're facing today in our community. I was raised in the 46806 zip code and family home in the 46806 zip code, and a lot of the work that I do is in that community. Andrea has other friends still in the 46806 zip code that have lost their babies, and she's been able to be there to talk with them and support them through their journey of loss. This is a bigger problem. We don't have the solution to the problem, but we need to be aware that this problem exists and what we can do to help mothers.
Statistics pretty much show that, African American babies are almost 2 times the risk of death in the first year compared to Caucasian babies, Latino babies as well. The risk is also higher, and obviously that those are the populations that live in this area code. I grew up here. I have family members, friends, cousins, and the 46805, 46806 area code, and I'm like, this could potentially, be my family member.
I grew up here in the community. I raised my kids here. When I look at my kids, they had a chance, they had an opportunity. And so when I look at people who don't have that chance, who don't have that opportunity, it really hurts, because they should. I mean, this is 2017, not 1940. What's going on here? Why do you have this high rate just in these 2 areas, but it's just happened to a predominantly black, mom or father? What's going on here?
Preterm delivery, complications in pregnancies. A lot of these moms have like diabetes, obesity, or, drug use, those sorts of things. They're not using resources or not aware of the resources that are here for them to get help in those sorts of things. Prenatal care, postnatal care. The resources are here, but for some reason they're not taking advantage of that. And that's just something that we're really trying to figure out and start to put these resources at their front doorstep. Instead of them coming out to seek us, we're going to go out and seek them.
I know through my pregnancy with Jordan, I was seeing doctors twice a month. And most of my doctor's appointments were out north. That's about 20 to 30 minutes away. I had reliable transportation. I didn't have gas money issues, but I had a lot of doctor's appointments. Do these mothers have the resources to get back and forth to their doctor's appointments so they know how to care for themselves and to care for the baby? You have lack of resources, you have lack of transportation, you have lack of support, just lack of knowledge all around. You have to find ways to knock down some of these barriers. You might have to bring the OBGYNs and the high-risk doctors in their community.
We've got to go to the neighborhoods. We've got to go door to door. We've got to do something, because 9 times out of 10, most people in their neighborhood is not going to come to you.
We got to get patients in. We got to get them seen. Even if we have to go out into the communities and get them seen, I don't think they understand how important it is to, plan to bring a healthy baby home. And, not only that, but during that first year, how critical it is to keep that baby safe.
Even though you might educate those mothers before they leave the hospital, that's just stuff out of the window, because they have all these other stressors they're thinking about. Wait until they get back into their environment, then go and teach them. That's one of the pieces that we're going to look at in the African American Healthcare Alliance, is going in after, they have a baby, assessing their environment, and then providing safe practice for them.
We really want to start getting people in these communities, and even if we have to go door to door and provide prenatal care, or go to the churches and provide prenatal care, that's just what we have to do.
One thing is for this initiative is that we are dedicated. Almost 60 members are dedicated to this End for Mortality initiative, and we all care, and I think we all have a piece in the community.
So as far as the African American Health Alliance, we're currently doing lots of fundraisers so we can start our initiatives. And since education is such a huge piece, we're doing videos, we're starting a website. Everybody has cell phones these days, so we want to, potentially start a phone app. We may be reaching out to Uber or some type of transportation services to maybe even carpool to get these women, to different locations in order to provide care.
This is the first organization, nonprofit, that's really raised money as a grassroots for End for Mortality. This is totally going to be spent in the community on programs just for End for Mortality.
Honestly, we don't know how much this is going to cost, but we're in this for the long run, and it doesn't matter. There's no price tag that you can put on, an infant's life or a mother's life, so we're just ready.
We know we can make a difference. We have made a difference in our other programs, and we know we'll make a difference in this, and we feel that it's up to us. My goal within a year with this organization is to have our programs up and running, but to also have that area being educated. I want every household over there to know what End for Mortality is. I want every household to know where they can go get help. And I want them to know that somebody in that cares for them.
What's a better cause than to save a life? These kids, they deserve more. They deserve a chance. And, when they don't have the simple supplies and resources that they need to just survive through the first year of life, it's unfair.
Society don't teach you that a mother buries their child. It's the other way around. How can you help the next person?